Welcome to another MU Healthcare Ask the Expert podcast. My name is Cosmo, Morning Show co-host on Y107. And, trying to grow or start your family can be all the feels, the most exciting, the most exhilarating, the most nerve-wracking, overwhelming journey that you're ever going to go on. And MU Healthcare's Reproductive Health and Family Center is here to help you guys. And joining us this morning, Dr. Tia Brodeur, a reproductive endocrinologist who's helping lead the center into a whole new chapter of expert care. And we're going to start this morning, Doctor, with some big news. MU Healthcare's Fertility Center, it's back. What makes this new chapter so special?
It's a really exciting time. So we are the only center in mid-Missouri that offers complete reproductive and maternity care all under one roof. And so from family planning and fertility treatments to prenatal care, delivering in our beautiful brand new birthing center, postpartum support, patients can get everything they need from the same connected team. And of course, everybody's fertility story is unique, so we try not to take a one-size-fits-all approach. We try to meet people where they're at and try to fit everyone's care model to their comfort level and their values. So whether they're interested in fertility preservation, just exploring treatment options, including things like needle-free IVF, or just folks looking for a second opinion.
MU Healthcare, an academic health system. So how does that change the way you're able to support your patients, Doctor?
So being academic means that we have everything we need to support moms, dads, babies, all under one roof. And this is before, during, and after fertility treatment. So, for example, some fertility treatments can increase the chance of having multiple pregnancies, such as twins. And that can mean needing extra care, extra monitoring, and special delivery planning. And so I can work directly with our high-risk OB specialists, the maternal fetal medicine doctors, to coordinate everything under one roof so that care is smooth and seamless. We also have specialists in genetics, urology, and other areas that can impact men and women's fertility within MU Healthcare. That allows us to get answers and also gives patients access to advanced testing and the latest research.
Trying to start or grow your family can be very exciting and sometimes a lot overwhelming. Fortunately, MU Healthcare's Reproductive Health and Fertility Center is here to help you with doctors like Tia Brodeur. She's a reproductive endocrinologist, and she is here with us this morning. I know your team works hard to make the experience as comfortable as possible, especially for those who don't love needles. Can you talk more about what your center offers in those cases?
Yes, so it's really exciting. We're trying to use a low needle approach wherever we can. And so low needle or needle free can be a great option for many patients. And we do that by either altering dosage, altering the kinds of medications to reduce the number of shots needed or reduce the frequency of shots. And so oftentimes we can just use oral hormonal fertility medications and forego shots altogether. For advanced procedures like egg retrievals that can be uncomfortable and can make patients feel nervous, we also offer full anesthesia with our anesthesiology team so the patient is fully asleep and comfortable during that procedure.
We've got an awesome doctor with us this morning, Dr. Tia Brodeur, a reproductive endocrinologist who is helping lead the center into the new chapter of care. Now, if someone's over 40 and wondering about their opportunities, their chances, what would you say to them listening this morning?
I would say that we can currently help many patients in their 40s achieve healthy pregnancies. And so it's never too late to have the conversation. It's also never too early to have the conversation. Fertility, as we know, changes with age, but fortunately we can offer in-depth testing, including hormonal evaluations and treatment options that are tailored to each person. If pregnancy doesn't seem like it's going to be possible naturally, we can explore options like IVF or donor-related conception. And so even if a patient is not in their 40s and they're not ready to have a baby now, we can explore options for fertility preservation to keep that door open.
Fertility world, it can be a maze of tests and procedures and a lot of confusing things and steps. How does your team guide patients through the whole process?
So you're right, it can be overwhelming. And so the first thing and most important thing we do is really take the time to understand each person's story, what they've tried, what's worked, what hasn't worked, and what their goals and concerns are. Not every fertility journey has to start with medications or a strict protocol. Sometimes the right starting place is going directly to IVF. Sometimes it's not even a treatment, and more so timing support and lifestyle changes. So I work with patients to build a plan that makes sense for them, one that's thoughtful and doesn't waste time or money on unnecessary treatments.
Again, a huge thank you, Dr. Brodeur, for your time. And whether you're ready to start a family or just want to start understanding your options, MU Healthcare's Reproductive Health and Fertility Center, here to support you with expert care every step of the way. MUhealth.org/fertility-experts.